My journey through med school in the US was sort of all over the place during my clinical training years. I spent time in Houma, Louisiana, to Oklahoma City, Cleveland, and New York as well. But Shreveport, LSU Shreveport, gave me a chance to sort of stay in one place and put down my roots, so I'm always very grateful for that. So I'm a non-invasive general cardiologist by training, and so I specialize in all things general cardiology. So that includes acute and long-term management of coronary artery disease, hypertension, valvular disorders, rhythm disturbances, heart failure, non-invasive testing, and most importantly, preventative cardiology. Cardiology is something that sort of came a little bit easier to me, something I understood a little bit better during medical school. I thoroughly enjoyed learning about cardiac physiology. That was sort of my first introduction to the field. And then obviously during my medicine training at LSU Shreveport, I got a much broader experience into the field of cardiology, and that further sort of solidified my interest in the field. Cardiology has an ever-changing landscape. There's always new research in the pipeline. There's new practice-changing guidelines, new medical therapies, technology, and it keeps me constantly learning. And I think for me, I think that's the best way to make sure that I'm constantly improving myself and doing the best for my patients. Medicine is rarely a one-size-fits-all approach, and I believe in getting to know the patients a little bit more than just the surface level, engaging them in conversations about getting to know their patient's background, just so I can help to understand them better and help me come up with a well-thought-out and individualized care for my patients. I'm obviously passionate about medicine. That comes number one for me. Helping people through or giving them a guiding hand at their most vulnerable time is one of the reasons why I got into medicine, and cardiology lets me do that. But outside of that, I'm a huge sports guy. I try to stay as active as I can. I love playing basketball. And being from Toronto, I'm a huge local Toronto sports guy, so I have a very huge passion for the Maple Leafs, the Raptors, the Blue Jays. And I also have a lot of passion for cars. I'm a big car guy as well, so my dream one day would be to either restore or own a 1967 Mustang, Shelby GT500 or a Fastback. So it's a very gratifying feeling to see a patient in the hospital when they're not, feeling that well, and you're able to, help them and your team able to get them better, and them going home, and then seeing them in clinic, for follow-up a couple of months later, and they're doing a lot better on medications or whatever the treatment it was. It's always, I think that's what keeps, most doctors going, and definitely for me as well. I think seeing that sort of gratification is nice.